There are three primary areas that employers should keep in mind when thinking about compliance for their health plan. First of those is ERISA, which governs employer-sponsored benefit plans. ERISA was a law created in the early 1970s that has been applied to basically set the rules for how an employer that creates their own health plan should do that.
ERISA requires several things of plan sponsors, plan administrators. One of those things is to provide notices of what benefits are available to employees. Types of notices that you might expect would be plan document and a summary plan document with any tax filing notices that you might need to be aware of. This is to make employees aware of the rights available to them under ERISA. And with the right service provider, employers can feel confident knowing that they're distributing the right notices in the right formats. So HIPAA requires that you safeguard patient data. Employers might find themselves subject to certain HIPAA rules, and with the right service provider, it can be relatively easy to navigate those waters.
So in addition to keeping track of privacy obligations with documents that contain patient information, another thing that HIPAA requires is that anyone who handles that information, particularly if it's electronic, keep it secure. And that basically means that you have to have systems in place that control who has access to that type of information if you keep any of it on your systems. For an HR director, they'll want to make sure they work with their IT department to look at what kind of controls are around who has access to any folders where patient data is maintained or anything else that in relation to running the health plan the HR department keeps that's sensitive member information for the plan. So the third primary area of the law that impacts health plans is tax laws. So like other types of benefit plans, health plans come with a tax benefit to both employees and employers. As dollars go in to support the plan, those are provided on a tax-free basis.
You know, there are certainly tax advantages when you're considering self-funding, and to take advantage of those, you need to be aware of your compliance obligations. Things like making sure you're not discriminating unfairly in favor of your highly compensated employees.
There's one other area of the tax laws that actually provides some additional benefit to employers and employees, and that's this concept of a health savings account. Health savings accounts are a great vehicle under the tax laws where employees can set aside dollars and employers can contribute dollars on a tax-free basis, and those monies can be used toward deductibles, toward the payment of claims, and employees can keep that money for the rest of their life until such time as they need to use that for their medical expenses. It's a great asset for employees, it's a great savings vehicle for employees, and more importantly, it's a great avenue for employers to engage with participants in the health plan, to be conscious of where their health plan dollars are spent, and to use them in a way that not only promotes their own health, but also the financial stability and viability and strength of both their dollars and the health plan's dollars.
As the markets continue to move towards a consumer-driven economy, it's important for employees to be mindful of kind of their options and how to best take advantage of the benefits available through their employers. We find ourselves in a challenging environment, and it's important to be able to offer great incentives and great packages to employees, and a self-funded health plan is a great opportunity to be able to do that. So managing the compliance burdens, oftentimes the risk is worth the reward, and managing those obligations isn't as complicated as you might think once you have a good trusted advisor to help you navigate that.